started. So thank you again for joining the session here today. So we're going to be talking about blood flow restriction training, and that's kind of a new thing that we're starting here at Union PT. I will give you a little bit of a background about like what it is and why we're using it and all that kind of business. Maybe. There we go. All right, so blood flow restriction, what is it? It is using bands placed around your upper arm, as you can see in the photo right there, or at your upper leg. And what we do is we'll basically like inflate them, clamp it down a little bit, and it will limit the arterial inflow to a certain amount, but it will completely limit your venous outflow. So some blood is coming in, blood is not coming out, and then we'll perform some exercises. And then you might think, why would I do that? So basically how it came up is it started in Japan in the 60s. In the bottom right corner you can see here there's like a photo of sitting Seiza. So there was a physician who was also a bodybuilder in Japan in the 60s. He was at a funeral ceremony where he would be sitting in this position for a long time. And when he got up, he found that it felt as if he had done a really hard workout. So he kind of began experimenting on himself in the 60s. And then in the 70s, he had a bilateral ankle fracture and was like, okay, well, this is the time to kind of see like how this can be put into practice. And then, long story short, he recovered much quicker than he would have expected and didn't have the same kind of muscle atrophy that would have been expected after being in casts in both legs for a while. So he kind of developed these clinics in Japan in the 70s, 80s, 90s, and then in the 2000s, 2010s, it started kind of becoming a little bit more popularized in weightlifting and pro sports. And that's kind of when the research started taking off. And then like, you guys might have like kind of seen it in popular magazines and like on TV. And so like, here's just like a few quotes and a few excerpts from magazines, and it's been called like a game changer. It's the fastest way to make your muscles grow. It's pretty awesome for increasing muscle strength and size. So you know we're starting to hear about this not just from like little tidbits that we're getting from pro sports, but we're also kind of getting it in these popular magazines and popular reception. And then so as I was saying, like in the mid-2000s to 20-teens is when the research has really taken off, and there's been like hundreds and hundreds of articles on BFR since. So I know this is a little bit of a busy slide, but we'll just kind of go through a little bit. I don't want to read at you too much. But this is from JOSPT, which is kind of like the outpatient PT journal, and this is an editorial from May of last year. So like, it took more than 30 years in practice, but we eventually got to a clinical cheat. Will there be another in my lifetime? I seriously doubt it. So that is pretty high praise for this new treatment that we're kind of rolling out here. And the big thing that we can see is we can see strengthening or like muscle growth in much shorter times than we would typically expect with exercise. The duration to see that is much less. So like what that translates to is a lot shorter rehab from injury or rehab from surgery. We also see increased muscular endurance. We see diminished atrophy after surgery. We see improved muscle recruitment and even improved VO2 max and cardiovascular improvements. So we're seeing strength gains, we're seeing endurance gains, and we're seeing cardiovascular gains. So pretty cool stuff. But there's more. So in some recent literature, we're starting to see some like even upstream responses. So like even though the band is at your upper arm or is at your mid-thigh, we're starting to see some responses in muscles that aren't even having that same kind of occlusion or that same kind of limitation to the blood flow. And we'll get into the why for that in a little bit. We're seeing tendon response. So with BFR, we often do much lighter loads, which doesn't put the same kind of stress on your connective tissue. But we're still seeing like a similar kind of response in our connective tissue that we would get otherwise. Another kind of even more surprising outcome is that we're seeing some opposite side response. So even though we might be doing this on our right knee, we would see a response in our left as well, which is pretty cool. So it works in two kind of different pathways. So what we're doing is when we have this band on our arm or on our leg, we are limiting the amount of blood that's able to go to and through the system. When you do that, we start to get this accumulation of metabolites, so the things that are basically the byproduct of exercise, and it creates an acidic environment, and it kind of creates this chemical cascade, which leads to a response that we would normally get from like a really heavy exercise. And what it does is, you can kind of see in this diagram here, we have the cuff, we have the accumulation of hydrogen ions, so it's more acidic, and then it stimulates your anterior pituitary gland, which releases growth hormone, and it kind of stimulates muscle growth with much lower load. The other way that it works is, it's not in this image right here, but it will work on kind of targeting an enzyme in your muscle cells that is responsible for protein synthesis. So when we create this hypoxic environment or this low oxygen environment, it stimulates the mTOR pathway, which is just an enzyme in your muscles, and it stimulates muscle growth. And in research, they found that this is kind of present when a person is having a heart attack. There's low oxygen levels, and it kind of stimulates this response to protect your cardiac cells. And is it safe? So like with any exercise, there is some inherent risk. But the rate of injury is very similar with BFR, or blood flow restriction. So like, it might seem or sound kind of scary by putting these cuffs on, limiting your blood, and then doing these exercises. But the rate of injury is extremely similar to just regular exercise. And then in some studies that they did, they found like they're testing blood markers for looking for like clotting formation, and there's no change in blood markers that show that. And they even did that amongst patients with heart disease, and same thing. So with that in mind, we do still have some reasons why we would maybe not want to do BFR. And that's just a person who has a history of blood clots, and that's just kind of for safety's sake. Diabetes or venous compromise, so if your blood vessels are not as robust or as strong or capable of handling the increased pressure that BFR does kind of give you, we would kind of shy away from doing that. People with high blood pressure or people with sickle cell trait are a couple of other reasons that we might want to limit that. And then there are a couple others too, but those are the main ones. And if you do come into clinic, there would be a thorough screen to make sure that there are no reasons we would not do the blood flow restriction training with you. And then what would you expect? So let's say you do come in the clinic, we do find that BFR is the right thing to get you rehabbing. What would you expect in that session? One, it's going to be tight under the band. It will only be tight for the exercise that we'll be performing, release it in between, let the blood flow come back underneath the strap, and then we will do that usually 2 or 3 different exercises. And then even though we will be doing a really light load, it'll feel hard. It'll feel like as if you were doing a really difficult exercise. Just like anecdotally, I had a patient today who was just doing ankle pumps, and the day later she was saying it felt like she had run 10 miles. So yeah, expect to feel as if you've gotten a hard workout. And then appearance underneath the strap, you'll probably see some color change, but it's only transient. It'll come back as soon as we take the strap off. Your skin will get a little bit red, maybe a little bit purple. Your veins will kind of pop out. Bruising is rare, but it's not unheard of, especially when we're doing the straps at your upper arm. And then what that means is we just kind of crank it down a little bit next time. So who needs this? Like, why would we be performing this? So basically, when we have an injured tissue, something that we can't load with the kind of strength or hypertrophy protocol, so usually we need to be like loading this tissue and like to get strength gains, we want to be closer to your 1 rep max. But if you have an injured tissue, we can't do that. Like, both for the integrity of the tissue and just pain. Like, you're not going to be able to produce that force. With BFR, we can still maintain those strength gains, and we can limit loss when you are in that kind of acute or subacute phase. And for athletes, part of that means is like when you're in season training and we don't want to be overloading the tissue and we want to be in kind of like a safe zone where we can even train more frequently, BFR allows you to maintain or even increase your training frequency without having too much stress on your tissues. And that's really apparent in our post-op patients, or even patients who are doing like their prehab, so getting strong before surgery and getting those muscles ready before the surgery without doing like a heavy load on those tissues. And then, as I was saying earlier, in some of the recent studies, is that we do see some tendon remodeling. So like, for example, a climber who has like an A2 pulley strain, and we're not in a safe zone where we can actually like crank on those tissues, we can limit our loss and we can continue to remodel the tissue in a healthy way with a low load. And then like, as we limit the amount of oxygen that is flowing through the blood in doing these exercises, it will stimulate our type 2 fibers, our type 2B fibers, which is our like fast twitch muscles, the ones that do not rely on oxygen for exercises. So it's another adjunct to getting like strength and power and explosive strength that we wouldn't be able to get otherwise. So there's two main established protocols for BFR. Usually it's the resistive exercise, so this one over on the left over here. We usually perform it 2 to 3 times a week. You can even do it up to 1 or 2 times a day. The intensity of the exercise is much less than traditional. It's almost like it's 20 to 40% of our 1 rep max. And then it's performed in 4 sets of 30 reps, 15, 15, 15, with a short break in between. And then on the bottom there is just the amount of occlusion, and I'll talk a little bit about how we will measure that shortly. And then we also can use it in a endurance capacity too. So this one is a little bit less well studied, a little bit less research for it, but also similar results, similar strength and hypertrophy gains, but doing more of like a continuous endurance exercise, and we've even seen a little bit increase in the VO2 max with that protocol also. Okay, so how we use it. 1, we will get you screened and cleared to make sure that you would be an appropriate person for blood flow restriction training. This photo down here is a Doppler ultrasound. So we will find your pulse at your wrist, at your radial pulse, or at your posterior tibial pulse. And then, so 1, we'll find the pulse, we'll inflate the cuff until we find the point where that pulse disappears, and that is our occlusion percentage. Then we will release the pressure in the cuff to the appropriate amount of occlusion percentage. So like with the upper extremity, it's 30 to 60% is what we're looking for. So it's still pretty tight. Your lower extremity will be 40 to 80%. And then we'll perform those exercises in the manner that we were talking about with those previous protocols. In between exercises, release, let the blood get into the tissue for a few minutes, so following up with you guys, and then perform that, usually 2 to 3 different exercises. So here at Union, we use the Be Strong system, and I know some of the people will be able to see this, some are not. You can look it up online, but it's basically an adjustable strap. It will allow us to adjust the pressure and basically the width of the cuff, which kind of influences how uncomfortable or comfortable it might be. And then beyond BFR at Union, like, it is just one tool in the toolbox. So like, BFR is one way to get better, but it's not the only way to get better. So like manual therapy, different like movement analysis are things that we can perform that like just going into like an athletic trainer and getting BFR is not necessarily equipped to handle. And then we're also outdoor athletes ourselves, so like we're climbers and mountain bikers and skiers and snowboarders, and we kind of get the stresses that would be applied in these sports that we're trying to get back to. So just a little touch base, there's going to be a couple other upcoming online workshops if either of these are interesting for you. So tomorrow there's going to be an acute whiplash injury one with Amanda. Oops. And then Mitch, the owner of PT, or owner of the Union PT, is going to be given one on preventing and managing climber shoulder issues. And that'll be on June 4th. So check it out.